So thank you guys for being here today as we talk about what's next for the Oklahoma State Department of Health. Before we move forward with the exciting new chapter, I want Oklahomans to know how we got here. As you might have heard, the Senate chose not to confirm Commissioner Gary Cox, and I want to thank him for his service in leading the health department over the last 8 months. I think he's done a great job leading Oklahoma through this pandemic. There's no doubt in my mind that the team he assembled at the State Department of Health is responsible for saving many lives in Oklahoma with our state's comprehensive response to COVID-19. Here are some of the things that we've accomplished during this pandemic. The State Department of Health, we've partnered with county health departments, healthcare systems, to quickly stand up over 80 mobile free test sites all across the state to make sure that we had access to every single Oklahoman. We're one of the national leaders in COVID-19 transparency. Oklahomans can access information by city, zip code, county, to get a clear picture of how the virus is spreading and arm themselves with the facts to protect themselves and their families. We also created a hospital surge plan to make sure that we did not overrun our hospital system. We provided guidance for our industries as we move to safely and measurably reopen and recover safely with our economy. We have developed 11 different strike teams to quickly and aggressively respond to our long-term care facilities with outbreaks. And we are training and deploying over 500 contact tracers all across the state to contain clusters of cases that might emerge as we know that this coronavirus is still in Oklahoma, it's still in every single state in the country. We have found an incredible choice to be our next leader at the State Department of Health. And I'm confident our State Department of Health will be in great hands. This morning, I am naming Colonel Lance Frye, medical doctor, to be the Interim Commissioner of Health. Colonel Frye has been serving as the state's air surgeon for the Oklahoma Air National Guard, and he's the interim department chair, residency program director, and a professor at Oklahoma State University Center for Health Sciences. As state air surgeon, Colonel Frye is the Air National Guard's senior medical officer and senior advisor to the Adjutant General of the state of Oklahoma on all medical issues. He deployed in support of Operation Enduring Freedom and Iraqi Freedom, and served as a flight surgeon on a combat search and rescue team in the highest threat environments in Afghanistan. During the COVID-19 pandemic, Colonel Frye has played a key role for our administration on the Governor's Solutions Task Force. He's been working with the National Guard, and we had him deployed at the State Department of Health. He's done a great job preparing and implementing our hospital surge plan was one of the tasks that we'd given him. So Secretary Lothridge has worked very closely with Colonel Frye at our command center for weeks now, and I'd like him to talk about why Colonel Frye stood out above the crowd and we named him as the interim director. So Secretary Lothridge.
Thank you, Governor. The United States Air Force was formed by act of Congress in 1947, following the conclusion of World War II. But its antecedent lay in the Department of the Army and was formed in 1907, the same year that Oklahoman was born. This seems a uniquely fitting fact for a true son of Oklahoma like Colonel Lance Frye. Colonel Frye and I have worked very closely together over the last 2 months, where he has been an integral part of our COVID-19 response. He has carried in any number of specific duties, but I'd call out one because it showed two sides of his capability and his character. In developing our surge plan, one of those critical elements to how any state would respond to a global pandemic. Colonel Frye had the organizational acumen, he had the leadership capability, he had the command presence to help us develop what at this point is being hailed as a leading model for surge planning in rural states. We're looking forward in coming days to sharing some of the information that we have heard coming out specifically of the White House and the administration about how Oklahoma's plan is being looked at as a model for future responses. Well, I will tell you that Colonel Frye was central to the development of that plan. That's a testament to, again, to his organizational capabilities and a reflection of what he's done as a member of the U.S. Armed Forces. But beyond that, beyond merely developing the plan, Colonel Frye has been integral in enacting the plan. I'll give this example. When we had an outbreak in Texas County, centered around Guyman, Colonel Frye did not merely stay at the command center, helping to direct our efforts, but he went himself. This is no surprise coming out of someone who has worked in theater, literally picking up wounded folks off of battlefields. It would stand to reason that his first response when we had an outbreak would be to go himself. I think this, among many other examples I could give, has been what I have seen out of the Colonel over our work together the last couple of months. It's what made me utterly confident in recommending him as the right individual to step into this leadership position to the governor. When the Air Force was formed in 1947, it stood up under the following model. Integrity first, service before self, excellence in everything we do. I believe they could have had Colonel Frye in mind when they set those words in motion. It's an honor to recommend to the governor the appointment of Colonel Frye, and it's now a privilege to introduce him to you. Colonel Frye, off we go.
Thank you, Governor and Secretary Loffridge, for trusting me with this role. It's an honor to serve our state in such a critical time in history. As you might tell, serving is in my DNA. I've spent time as a flight surgeon in the United States Air Force, and I've been proud to serve in the Oklahoma National Guard. I served as a commander at the 138th Medical Group until 2017, and I've been the state air surgeon for the past 3.5 years. For the last several weeks, I've been on orders with the National Guard as part of the Governor's Solution Task Force, playing a key role in preparing the hospital surge plan and communicating with healthcare providers and professionals across the state through OSU's Project ECHO training sessions. I've been proud to serve alongside members of the Oklahoma State Department of Health as we all work together to contain the COVID-19 outbreak. The governor has said his #1 goal is to protect the health and lives of Oklahomans, and that is a mission I'm honored to carry out. To the hardworking men and women of Oklahoma State Department of Health, thank you for your tireless work and effort. I've seen the long hours that you've put in, and I'm going to work with you to support you in every way that I can. We are all in this together, and I'm confident we will continue the great progress we have made against COVID-19. Again, thank you, Governor Stitt, for this opportunity. It's an honor to serve my state at this time. I also want to remind everyone that it's Memorial Day weekend, so I want to encourage everyone to pause a moment to remember those service members who've given their lives for their country. Thank you. Governor.
Thank you so much, Colonel Frye. Our state is truly lucky to have you. You know, I want to remind Oklahomans that my #1 goal remains, like Colonel Frye just said, to protect the health and lives of Oklahomans. Colonel Frye is the right leader at the right time to continue that mission and carry that out for the remainder of his time serving. I know we're not going to skip a beat here with him. We continue to be in great shape on our data as we fight COVID-19 in the state of Oklahoma. We're almost a full month now into our phase reopening plan. We have just 190 people in the hospital all across the state of Oklahoma with COVID-19. As a reminder to Oklahomans, we have built our hospital capacity. We have 4,600 COVID beds available. We have now performed over 150,000 tests, and just 4.3% of those tests are coming back positive. So out of every 1,000 tests that we run, 43 are coming back positive, 957 negative. We're also in great shape on our PPE. Our system is on the way right now to stand up. It's coming from FEMA so we can sterilize and recycle N95 masks. As I've said before, coronavirus is still in the United States. It's in Oklahoma. It's in every state. So how do we move forward from here? We are going to continue to be proactive in our fight, and we will revive our economy to give prosperity and freedom back to Oklahomans as we measurably reopen. With that, let me just pause for a second, and we want to open it up to a few questions, and the Colonel's available to answer questions as well.
Are you attending Colonel Frye's appointment? Are you going to seek full confirmation from the Senate, or is this temporary while you do a more nationwide search?
It is. We have to get the appointments in by May 1st for this session, but so it would be all the way till next year. So he'll be the interim until next year, and then the idea would be to remove that and put him before the Senate for full confirmation. It would have to start next February. Yeah, Carmen?
This sounds callous, but does he meet the requirements set up in state statute?
Yes, he is a medical doctor. And the statute says you have to have a master's degree and 5 years experience, or a medical doctor or a PhD. And he has a medical degree.
Also, sorry to talk about you as if you're not here.
Can I ask a logistical question? Are you considered doctor, colonel, doctor? We can't use MD and
Yeah. Good question. I'm not really sure. It's Colonel, but I'm also a doctor. So when I'm in my military status, they usually go by Colonel. But I'm not going to be always in a flight suit and on active duty active duty status. So it'll be doctor.
What's been an observation during your time working to combat this pandemic? I doubt you've faced anything quite like this before in your professional career. So what's an observation? What's a story that you can tell? What's something that you have learned in the last 2 months that you want to take into this position?
It requires everyone. It requires teamwork. You know, what I've really seen and enjoyed and am proud of is the fact that, you know, the governor was able to put together a multi-agency group of people that really brought all Oklahomans together to work through this, and it required every single one of us. Everything from, you know, the government to corporations to individuals, you know, have all been involved in this process. They all had an important role to play, and will keep moving forward in that same manner.
Are you going to continue on in your role in the National Guard?
Yes.
Where are you from in Oklahoma?
Lindsay.
Lindsay.
Mm-hmm.
And do you live in Lindsay now, or do you live
No, I live in Tulsa.
What do you anticipate being one of the biggest challenges that you or the agency face in this time?
For me, my challenge is going to be just getting acclimated to the new role and moving forward. I've been working alongside these people for the last 2 months, and they've all been doing an outstanding job. So I think we just need to really build upon what we've already started and keep that going, continue with the transparency of the data that we've been getting, and, you know, working with these county, city health departments, and really strengthen up those local responses.
Do you, since you live in Tulsa, do you plan to move to OKC, or, I mean, would you operate as interim director mostly from Tulsa?
I'm sure that I will have to have a dual residence of some type. So.
Your first weekend is Memorial Day weekend. Do you have a message to Oklahomans on a weekend that they gather together typically for safety?
Absolutely. I still want to encourage everyone to remain with the social distancing, washing their hands, try not to touch their faces, but as they enjoy, their families in a safe manner, please enjoy them, but remember also those soldiers that have fallen for us.
That's Colonel, do you have a personal question?
57.
What in your time, Secretary Law mentioned a couple things, what in your time has most prepared you for this? I mean, maybe nothing can prepare for a pandemic, but what has prepared you?
I think some people are really good at dealing with emergent situations, and I've always been pretty good at that, but I think my military training had a tremendous amount to do with it. We were, as the governor had said, done everything from battlefield pickups and Blackhawks, of injured soldiers and civilians to, being a validating flight surgeon for a whole area of responsibility. So, and quite honestly, being an OBGYN is either really great or it's an emergency. And so you learn how to handle those situations well.
Why did you want this job? I mean, this is not the job that most people want.
I look at it as an opportunity to serve. I look at it as an opportunity to make a difference in the state. And I can't think of anything that would be more rewarding than that.
With your new role, is this part of the surveillance for testing nursing homes more than once, or maybe just every 17 days?
So we are putting together a plan for the continued surveillance of that. That's difficult to answer because every facility is different. It depends on the prevalence of disease in their population, what's going on in their communities and in their individual facilities as far as the timing of that. So we need to be able to put together some trigger points that they can follow to know what to do when those things occur.
Can you say how much this is costing the state?
I don't know that question, but they might be able to.
Can you elaborate a little bit more on your experience with the hospital surge plan of COVID and what that looked like for you?
Well, I was part of the Governor's Solution Task Force, so we would meet at the Multi-Agency Coordination Center, and we brought in all types of experts to help us through thinking really basically what do we have in the state that has been working, what's been there, and how can we build upon that. So we looked at, the Hospital Association helped us with pulling together a lot of data, and they were very instrumental in helping us get the information and that we needed from hospitals around the state. We knew that we already had the TREC trauma, basically referral transport system. And that's been working successfully throughout all the regions in the state for years. So we built upon that to be our management of the transfer of patients. We looked at the numbers that the Hospital Association got and looked at what was projected, and we thought if we plussed up 40% and asked everyone to do that, then we should be okay. But we also want to make sure that we had additional safety net plans in place beyond that. And that's the basics of it.
Do you think other states in our country should be modeling themselves after Oklahoma in response to COVID?
I do. I mean, we could talk about the healthcare surge plan for a while, but a big piece of that was we have some very rural areas of the state, and we needed to have expanded care for them and capability for them in those areas, because those patients are best normally if they're the less severe ones, if they're taken care of locally, where they're near family and friends and support. And so we really wanted to try to be able to get that to happen. So that telemedicine piece of going around the state is key. And I think that's going to be instrumental, not only helping us through this time, but in the future of our state as far as building a better medical care for our rural families.
I just have to ask, where's your stance and how are you prepared if there is a potential second wave?
I think we're very well prepared. We've developed a plan, we've got it in place. We're going to continue to strengthen that. We actually luckily we didn't have to fully engage the plan, through every hospital in the state, but when we had outbreaks, we were able to exercise it and learn from it. We saw what went well and what we could learn from, and we're continuing to improve.
Are you going to step down as the interim department chair, or are you going to wear 3 hats at once?
I'm not sure as of yet.
Thanks, everybody.
Thank you.
Thank you.